Hi, I'm Dr. Anthea Rhodes, paediatrician here at the Royal Children's Hospital in Melbourne, and your host for the Winter Wellness series of the Kids Health Info podcast. Something we see more of in winter and have seen more of in general in the last year is whooping cough. And joining me today to answer your questions and teach you a bit about whooping cough is Dr. Sarah McNab, our Head of Department of General Medicine here at the Royal Children's Hospital. Welcome, Sarah.
Thanks, Anthea. Thanks for having me.
From the Royal Children's Hospital Melbourne, this is the Kids Health Info podcast.
Let's start with a really common question parents have. What actually is whooping cough?
So whooping cough is also known as pertussis. It's a bacterial infection that can cause respiratory symptoms, so airway problems.
Okay, so if a child has whooping cough, how might it show up? What would the features be?
So early on, it can look like a common cold, so with a runny nose, a cough, sometimes a fever. But as it progresses, the cough can become more significant. The cough often comes in bursts, so quite dramatic bursts of coughing, where a child's airways get full of mucus, and at the end of the burst of coughing, they're struggling to breathe, and that's what produces that typical whoop, which is a big, sharp indrawing of breath at the end of a coughing episode. A child won't always have a whoop, of course. Sometimes they'll vomit, or sometimes they'll just have the coughing spasm. But the cough is really significant. This used to be called the 100-day cough because the cough would last for months.
Okay, and we've actually got a recording of whooping cough from a patient that we've had here at the hospital. So we might take a listen to that now, just so that parents can get a sense of what it might sound like. So that's obviously quite a severe and classic example of the cough. And in smaller babies, sometimes this might show up a bit differently. Can you tell us about that?
Yeah, in smaller babies, on top of coughing episodes where they struggle to breathe, they can also have episodes that are known as apneas, and so that is pauses in their breathing. If you have a baby that is having pauses in their breathing, that's a medical emergency and you need to seek medical attention immediately.
Let's go back a little bit to what causes it. So you mentioned it's also called pertussis.
Yes, so it's caused by a bacteria called Bordetella pertussis, and that's spread through droplets, so by other people coughing or by blowing your nose and not washing your hands and spreading the infection that way.
Okay, so that leads us into, recognising signs where there might be whooping cough happening and there might be a reason to see a healthcare provider or visit the emergency department. What should parents look out for?
So in most situations, whooping cough is not an emergency. So if your child has a cough that you think might be whooping cough, it is still a good idea to go and see your GP and to ask them whether your child might benefit from testing. One of the reasons to test is that we can give antibiotics, and that can sometimes change how long your child will cough for. But another important reason for antibiotics, it can change how long your child's infectious for. So when you have the cough from whooping cough, you're infectious usually for up to about 3 weeks. It's a long time to be spreading this infection. So that can be a reason to see your healthcare provider and get checked. In little babies, it's more worrisome. So if you have a little baby who you think might have whooping cough, then speaking either to your GP relatively quickly or presenting to emergency is the right thing to do.
And so why is it, Sarah, that babies are most at risk of more severe illness from whooping cough?
So one is just their size. There's a lot of mucus that's produced during whooping cough and it can block their airways. But another reason why it's more severe in babies typically is that they haven't yet had an opportunity to get vaccinated themselves. So we do thankfully have a great vaccine schedule, but little babies, and particularly those under 2 months of age, haven't yet had the opportunity to be vaccinated themselves. One amazing progress over the last little while is that mums can now be vaccinated during pregnancy. And some of the protection of that vaccine does pass on to the baby, and that has undoubtedly saved lives.
And so tell us a bit more about prevention of spread and the vaccination.
So vaccination is absolutely your number one way to prevent getting whooping cough and to prevent severe complications from whooping cough. So if you're pregnant, I would absolutely advise you to speak to your healthcare provider, so your midwife, your obstetrician, your GP, and ask them about the whooping cough vaccine. It's something that is extremely important to protect your baby. After birth, the baby can get vaccinated, but the first vaccine isn't until between 6 and 8 weeks of age, and so they are a little bit more vulnerable during that period, but less vulnerable if their mum has been vaccinated.
So for those little babies who are having vaccines over the first year of life, how long is it that they're still vulnerable or that parents should be particularly worried about whooping cough?
So over a baby's first 6 months of life, they'll have 3 vaccines that will protect them from whooping cough. So by the time they're 6 months, they're a bit bigger, which helps them to deal with the illness itself, but they've also had 3 vaccines themselves that really significantly helps protect them against whooping cough.
And what about advice for vaccination for other people around the baby aside from mum? So other parents, perhaps grandparents or other people in the household?
It's a great question. It's a thing that we would call cocooning a baby, so trying to protect a baby from other people who might give them an infection. So number one, the most important thing is for mum to be vaccinated, both for herself but also because the protection will pass through to the baby themselves. I personally think that cocooning a baby is a good idea. So if you can encourage other people in the family, making sure other children in the family are up to date with their schedule, that anyone who is in the same household is up to date with their vaccination schedule, and visitors to the house. The other thing that can be important in those first few months is encouraging that no one comes to the house if they're unwell. So particularly with whooping cough, the cough, as I said before, can go on for a very long period of time. And I think some people might think that that means that it's just a long-standing cough and they're not necessarily infectious. But again, this illness is infectious for 3 weeks.
Okay, so really helpful advice there about protecting that new baby. What about preventing spread once someone actually does have whooping cough? Is there anything that parents can do within the household to ensure that it doesn't spread from one person to the next?
Yes, so if someone in your household has been diagnosed with whooping cough, speaking to your local healthcare provider, so that would usually be your GP, is the best step. We can provide antibiotics that can reduce the length of time that you're infectious for, and that can help protect the rest of the family. Beyond that, they're the same measures that we're very used to with other respiratory infections. So trying to wash your hands. If you've blown your nose, to throw the tissue away and wash your hands again. Trying to physically separate, but that is very difficult within the same household. And there is a place for masking in this type of specific situation if you're trying to protect somebody from developing whooping cough.
Yeah, lots of great advice there, Sarah. All those practical measures that we hear time and time again but continue to be so important about hygiene to prevent spread, and of course vaccination as a really powerful and the most really effective way that we do have, particularly of preventing whooping cough, serious illness in those young babies.
Yeah, we're lucky that we have access to a good vaccine for whooping cough. It's been around for a long time now, and so thankfully in my time as a paediatrician, seeing little babies struggle to breathe with pertussis is quite rare. So I would really encourage mums to get the vaccine during pregnancy and for babies to get their vaccines as soon as they can.
And of course, there's more information for parents on our Kids Health Info fact sheet if they're looking for more details. Thanks so much for joining us today.
Thanks very much for having me.
Information in this podcast is general in nature and is intended to support, not replace, discussions with your doctor or healthcare professional. If you have concerns about your child, please consult your local healthcare professional for individual advice. This podcast is recorded on the traditional lands of the Wurundjeri people of the Kulin Nation, and we pay respects to their elders. Kids Health Info is funded thanks to the support of the Royal Children's Hospital Good Friday Appeal.